FALCOH Foundation is a non-profit health and humanitarian organization that was created in 2014 to serve the local population, especially those in rural areas and hard-to-reach areas, with healthcare services of good quality. We've been able to reach out to over 30 communities in the southwest region, where we've provided facility-based services, but also community outreach services in local communities. We've also carried out surgical campaigns in some of the public facilities where we don't have our own medical clinics running. For example, in Bangam, the foundation was able to carry out a surgical campaign where we did surgery, mostly neurophyes and appendectomy, for over 20 patients in Mwambong Health Center. This actually went a long way to support the Lone District Hospital, which was the referral hospital at the time. Recently, our team was in the Manu Division, in some communities like Bangapondo, where you would not find health centers, or even though the health centers exist because of the crisis, they've been deserted. And so we went to these communities and actually provided free services, consultations, diagnostics, essential diagnostic services, and also treated common ailments.
When we become open hospital, so we'll be fine. But now, struggle come, hospital the day bound. And when we begin is sick, before one struggle go for Mafe, it be very difficult. And sometimes, it flop. We will not get me several, take motor go begin die. So they for difficulty because things they need the worker. So like as soon as they come and when I go try way they open the hospital for we, so that more to be fine.
Vaccine they know they come. When it delivered, they will get now village like how we made them the born way for our first time. Now they take on for a year. Woman go be with belly. You know, go clinic, no day. Before you want to go clinic, you spend money, about 3 hours, 4 hours trekking. Before you go clinic, you pay imagine, woman will be able for take that kind of distance. You know, easy. And even if you born, you born carry picking for hand there like even 2-3 days. How you will carry for take about 3-4 hours to go for a vaccine. So therefore, in Chino Park, we get health center, but because of this problem, the crisis we're there for, everybody don't abandon everything. The thing don't turn our bush.
With respect to the conflicts that affected our region, our activities intensify, especially in terms of maternal health. So during the crisis periods, health facilities were burned. Access to health facilities were very difficult. Pregnant women were dying. And so we launched the Marie Pierre Maternal Health Initiative, where we work with internally displaced women and children. We provided them free maternal health care services through partner health facilities, government health facilities that were existing at that point in time. We had them do their ENCs, screening, lab until delivery that were paid by the foundation with support from partners. And this has been one of our key activities for the foundation. Every day a woman is dying because they cannot access healthcare. And so the foundation took it upon itself that accessing healthcare, saving life at birth in these communities, faraway communities where they have never gone to an ANC or a clinic, but for us providing these services, taking these services to them, is very essential to save not just the mother but the child.
I will be for hospital. I meet Madame Joanne. Madame Joanne take me now go for FALCOH. So FALCOH they help me for pay my hospital bills for the antenatal and even till I be born. So they pay my hospital bills since from then, and I be born twins. Now the two picking in this.
FALCOH don't really do one for me because not only the ecography, for delivery, now they pay the bills them for help me for so many things. Even when they invite me go there, they be still blessed. They don't believe me like that. I really be blessed for being part of FALCOH. So I pray they may they continue in this same spirit and may they continue to see help women the way they see them in their condition. And at the beginning this way they don't help me. I this don't big today, so I be very happy because I'm grateful for Muna.
It's painful to see a child who dies because of malaria when you know that with the appropriate care, this child is going to survive. It's painful to see people are homeless. It's painful to see people cannot get the basic necessities like vaccines. Children go unvaccinated. Pregnant women are not able to have access to primary health care, which is fundamental as to our human existence. So it's really been a humbling experience working in these zones, especially with the crisis. We have not been able to provide care the way we were trained and the way we would love to do it. We are functioning at about 40%. Just 40% of our health facilities are functioning. We have very limited resources, from human resource to material resource. What we are in dire need now is we need resources. Our facilities are shut down, some are burned down, some have been looted. If we can have equipment to at least re-energize these facilities, if we can have, it's a long shot, but if we can have human resources, people who can be mobilized, maybe under a particular paycheck to be able to work in such areas. But we need beds, we need cupboards, we need microscopes, we need blood pressure machines, we need any form of machine that we can get so we can bring health as closer to our community as possible. We need vehicles, we need water, we need alternate sources of energy.